Hello guys, welcome to another video of Elite Expertise YouTube channel. I'm Harika Vimarbu, practicing consultant pharmacist in Australia. I work as a clinical pharmacist educator for Monash Health Hospital in Melbourne. I'm also one of the directors of Elite Expertise, which is an online training platform facilitating overseas pharmacists, to attempt for KAPS exam conducted by Australian Pharmacy Council, which enables them to practice as an intern pharmacist in Australia and then achieve general registration. Today is a very special day for me because I've got my teacher in front of me who's accepted our invitation to give us a professional talk, an interview, and insights about Australian community practice. So I started my internship in 2019 with Sherri Barden in Moama Village Pharmacy. She was one of my preceptors and asthma educators as well. And I don't know, I'm feeling so nervous because I'm interviewing my teacher today. And I think Sherri made me what I'm today. She made me so confident, especially with counseling, going above and beyond in, like helping patients. And, it was so beautiful experience with Sherri as my teacher. I love you, Sherri, and thank you. I've got all the gratitude in the world for you. Thank you so much. And many, many thanks for accepting this, request for a professional talk. So I'll introduce you all to Sherri Barden, my teacher. So Sherri Barden studied at Monash University, Melbourne, and completed her internship in Royal Children's Hospital in the year of 1997. And from 1997, she's been a pharmacist serving as a community pharmacy in the rural areas of New South Wales, Victoria, and Queensland. So Sherri currently lives in her hometown at Moama with her husband and 3 teenage boys, working as a pharmacist in Moama Village Pharmacy, and that is where I completed my internship under her. Thank you so much, Sherri. So Moama Village Pharmacy is one of the best pharmacies in Australia. They were one of the top 5 finalists in the Pharmacy Guild Pharmacy of the Year Awards in the year of 2020. So Sherri has a special interest in the respiratory medicine, and so she has been an asthma educator pharmacist as well. So she has finished respiratory medicine and asthma training in Alfred Hospital, Lung Health Promotion Center in the year of 2017, and since then offered asthma education to her local community in Moama within her pharmacy. She has also been involved with 2 trials with Woolcock Institute of Medical Research over this time. In the year of 2021, Sherri became a member of the Respiratory Task Force leadership team and the Pharmaceutical Society of Australia's CSI Respiratory Care Leadership Group. In 2022, which is like a brand new thing, which I didn't know, in 2022, Sherri launched Moama Village Pharmacy's hay fever clinics as lead pharmacist and clinic champion. With the success of both clinics, Moama Village Pharmacy has now started charging a fee for service for these clinics. Sherri, with her support of her employees in Moama Village Pharmacy, has now started up Sherri Barden Consulting Coaching program, which offers coaching for other pharmacists to successfully implement their own hay fever and asthma clinic in Australia via face-to-face consulting and virtual sessions. So it has been an amazing journey. And Sherri, what Sherri has imparted me as an asthma educator is never forgettable. I'm so thankful to her. So I thought your immense community practice and experience would be whatever conversation we are going to have today would be of much benefit for the pharmacists, like intern pharmacists who are about to start their practice in Australia and, looking forward to achieve general registration in Australia. Thank you, Sherri. So is it okay if I ask you some questions?
Absolutely. Thanks for having me, Harika. That was so kind of you, your words. So thank you. And it's lovely to be here with you again.
So basically, Sherri, we are acting as like a facilitators for intern pharmacists, like overseas pharmacists, and some pharmacists who are practicing in Australia as intern pharmacists, sitting for their oral and written exam. So can you please guide them on how intern pharmacists can grow their career and excel as Australian pharmacists?
I always have to think about these questions, so giving me a moment to think. So I think just working really hard and really caring for that person in front of you that you're looking after. And as we know, each individual scenario is so different. So it's really important to take a good history and to really be a good listener and to really understand where that person's coming from, really exploring what that person treatments that they've tried, and getting a really big picture of that, of what's going on, and actually spending that time with them as well. Um, which time is precious, as we know, in each individual pharmacy, in each individual area of practice. But I think that's the best advice I can give, and from that you'll get the real satisfaction, because you'll get that just from caring and having that empathy for those other the people, the patients, is really important, and that'll give you all that job satisfaction and reward.
True. So, and I think that is what you taught me throughout my internship, to think about the person whom you're serving and like put them as your first priority, and then listen to them, listen to their problems, and come up with solutions. If you have that empathy and compassion, and you feel that their problem is yours, you'll come up with best ideas to solve their problems. And thank you so much, Sherri, for that. And you've taught me the same thing. Thank you. So, yes, so Australian pharmacists, the community pharmacists in Australia, we've been breaking that old tradition of just dispensing medications, labeling the boxes, and giving it away to the patients, and just counseling. But we've been more service oriented. We've went above and beyond our normal, regular, traditional way how we practice, and we have explored many options where we were able to contribute so much to the community in Australia. So, would you please be able to throw light on, how Australian pharmacists are playing a vital role in expansion of the services which community pharmacists provide in Australia?
Yes, sure. When we're talking about retail pharmacy, the first thing we think about is what we can offer our patients are meds checks. So if we're all doing that, it's a really important part of our role. And most pharmacies within Australia will have a consultation room, and those pharmacies that have got two pharmacists that are able to do that, then that is important. I realise that there's some pharmacies that have only got one pharmacist in there, which are unable to provide these services. But for those pharmacies that have got two pharmacists or more, meds checks are a really important service. And when we think about competition and our competitors and other different models, to be able to provide a professional service model is very satisfying and very rewarding, like I said before. So there's different streams, and if you have different interests, like we're seeing pharmacists that are charging fee for services for wound care, or for infant care, or what else can I think of? Pain specialising and things like that. My specialty is in respiratory care, so that's hence we've started up the hay fever and asthma clinics, and so I think we'll start to see a little bit more of that in Australia, hopefully over time, because I think with the state of the healthcare system at the moment, we need to have like an interdisciplinary approach and really help our patients and really be part of their healthcare team. And yeah, so that's sort of where we're sort of headed, I think, and I really hope we are, and that's why I'm doing what I'm doing.
Proud of you again. So, okay, so you yourself, you're an asthma educated pharmacist, been practicing for years as an asthma educated pharmacist. So, I mean, like, what is the scope of, the services which we offer? Like, there are some services like, expansion of pharmacist professional services like GP support pharmacists, diabetes educator pharmacists, which we have in our community, asthma educator pharmacists in Australia, and extending scope of pharmacists. So what do you think is the scope of, these services in future, coming up times from now?
Given evidence and statistics around medication misadventure, but also through poor adherence or poor technique, when I'm talking about respiratory, I think it all comes back to education. And so I think it's really important that yes, we are seeing more pharmacies now that have got diabetes educator pharmacists, and hopefully there's more asthma educator pharmacists, just to really specialise in those areas. And we know that some of these chronic conditions, so many people within Australia are affected, and so we can make a really huge difference, even just spending a little bit more time than what we traditionally have with those patients one-on-one, and they really do appreciate that time. So to educate them how to use their medication properly and to understand how their medication works can have a really profound effect on that, on their health literacy and their quality of life. So yes, really important.
Yep. So there's much more scope, and there's much more things which we can do as pharmacists. Yeah.
Absolutely.
So yeah. Um, so what is it like to be an intern pharmacist? So I know you finished your internship in Royal Children's Hospital in the year of 1996 to 1997. So how was your experience as an intern pharmacist? What did you learn, and how did that help you in being today what you are?
I had a wonderful experience at the Royal Children's Hospital. It was a very good educating hospital, and there was four of us, four girls that were all interns together, and I think that really helped, having the other girls next to me and going through this very similar experience at that time. And we had, because it was so clinically based, and we got to sit in on poisons information, drug information hotline. We went on all the different wards and those experiences. So it was absolutely fabulous. So I encourage, everyone to sort of try whatever they're interested in, whether it's retail or hospital, and really make the most of that experience, and really ask your educators, or get as much information out of them as you can. And if you're not happy, it's really important to express your feelings, and seek help where possible if you really find yourself just not getting the information, the education that you need. Like, I really like to think that most Australian pharmacists would be really amazing in that role. But again, going back to time and busy pharmacy workplaces, it's important for you to be happy in that internship year and really find it, like you, Harika, you thoroughly enjoyed it. You were the only intern, but you had a lot of pharmacists, a lot of around you, educating you, and just sort of again made you the person that you are. And from you really got them. You actually made the most of your opportunity to get the most out of each and every pharmacist that you worked with, which was beautiful.
I was so lucky. Like I think I had Sherri, I had Jill, I had Clint, I had Veronica, I had Mark, 5 teachers, and then I had Chanel as well. So it was like all teachers wanted to teach me, and I would like, please wait, let this teacher finish. Please wait. And it was so amazing. I was so lucky. I was the luckiest intern ever, I would feel, to have a pharmacy like Mohammed Village Pharmacy and to have teachers like you. It was a blessing for me, because I was so confident after my internship, that I could excel and, do something really different. And thank you so much for teaching me. It was a very lovely time. And even now, I miss those days of internship. And I hope you miss me as well.
Yes, we do. Yes, absolutely.
I really remember how, you used to ask me questions, and then, if I don't know the answers, and I would look for some prompting, and then you would say, no prompting. So beautiful experience. Thank you for being so lovely, teacher. So Sherri, I really want to know, what is this asthma and hay fever clinic is all about, and how does this work, and how did you come up with this unique idea of introducing this service in community pharmacy? And then you started training the other pharmacists to set up their own clinics, which was amazing, innovative. So I really want to know more about this. Can you please explain me?
So I saw the real need for patients with asthma to have more information and more one-on-one with their pharmacist. So because the statistics tell us that up to 90% of Australians use their inhalers incorrectly, and up to 50% of Australians with asthma don't use their preventers. They're not adherent to their preventers. So that with these alarming statistics make you then think about, well, what can we be doing to be helping those patients? So with my asthma clinic, it is a little bit more involved. It's a 30-minute consultation, whereas my hay fever clinic is a 15-minute consultation. And the hay fever sort of came a couple of years later, but that was after recognising that, or really knowing that 80% of patients with asthma have hay fever. And if we can't control that hay fever or understand that hay fever, then our asthma will flare. So, and from an Australian trial showed us that about 70% of patients will self-select their hay fever medication off the shelf, and only 15% of those patients will select the right treatment for them. So, and I've seen that for years and years and years. People will just go and pick an antihistamine tablet off the shelf, but it doesn't really work that well for them. So I was thinking about implementing this quick hay fever clinic, and the AUSTRALIA, which is the Australasian Society of Clinical Immunology and Allergy, they have a treatment plan for allergic rhinitis, which can be filled out by pharmacists, and this is it just here from their website. Unfortunately, with asthma, we can't write asthma action plans, but for hay fever, we can write a treatment management plan. So I'm able to capture that data and give the patients that education within 15 minutes. But my clinics also, because they're a fee for service, I also like to capture patient data because of my experience in trials. But and I actually offer my patients a 1-week follow-up and a 4-week follow-up phone call. Now, not all pharmacies will have the time for that, but I feel that is really, really important, because we want to give the patient that motivation to use their medication that I've recommended, or that's been recommended by their doctor, correctly. So correct technique, including nasal spray technique, and to be using their medications at the right dose every single day, not just when they've got symptoms. So we're talking about preventers here. So that's a little bit about the clinics. And with the success of the clinics we've had, I really wanted to take that to other pharmacies within Australia. So that's where I'm starting to do. I've started up my own business, and spending days with pharmacies face-to-face, giving them education in the morning and running clinics in the afternoon, or running a virtual education sessions with pharmacies, just 3 1-hour sessions to help them and coach them how to implement their own clinics as well. But I think in Australia we can be doing 15-minute asthma consults. Mine's just a little bit more detailed. But through my work with the Respiratory Task Force, we may come up with something like that. Or Asthma Australia do have a quick checklist as well. So, I think we need to start doing them just a little bit quicker as well.
Yeah. So it's amazing to listen all this. So it's a brand new concept, right? Like, it was never there before, and I lost the practice with community then. But it's so amazing to listen to this from you. Thank you so much, Sherri. Thank you so much for sharing that. So any tips for interns how to excel their intern oral and written exams in Australia?
It's been so long since I sat mine, but we've got an intern with us at the farm at the moment, and she sat hers, and yes, she did say it was difficult. Yes, there were some
she had her
questions.
Yeah.
There were some questions in there, some things that she found really difficult. So you just have to make the most of those opportunities and learn from different, like maybe spend some time with some other interns if you know them, and spend some time with some other pharmacists, like go and introduce yourself to some other pharmacies, and really, or even just ask the patients that you're dealing with face to face if you can just have a moment extra of their time, just to get a little bit more background into their situation. You just have to draw on all those experiences, so practically, but as well as knowing all the references to look at. So obviously the therapeutic guidelines are so important, the AMH is so important, but not really just focusing on one, but we want to have a really a holistic
Broad, yeah.
approach. So if we're talking broad approach, so if we're thinking about asthma, we're thinking about Asthma Australia and what organisations within Australia can really help benefit you in your learning, but also the patient as well. So I think, and if you don't know anything in the exam, that's like, as long as you know where to find the answer and to be confident in that response is really important, if that helps, Harika.
Yes, yeah, true. So Clint would always say that it's not wrong to not know anything, but it's wrong
Yes.
to not be able to find the answer for your questions. Like, go to the
Perfect.
reference
Yes.
book and find the answer. You can be a
Mm.
pharmacist who don't know everything. Like if someone asks you suddenly, you don't know it, that's fine. But you just kindly tell them, I'll go and look at my references and I'll come back to you with answers rather than giving them the wrong answer. And it started
Yeah,
with like
absolutely.
my internship with Sherri started with she showing her lungs. She has lungs, she has like a model of lungs in her pigeonhole, I think. And she, whenever she goes for an asthma education with her patients in the clinic, asthma clinic, she would carry that lungs with her and show how, asthma, what happens in asthma, the mechanism. And oh my God, it was so good. That I think that's the first lesson I had with Sherri. And then we started paint trial. It was an amazing time. Sherri,
Yes, yes.
the pain trial where we were able to suggest some modifications of pain medications and then try help them. We had some community sessions as well with exercise physiologists and all that. So
Yes.
amazing. And Sherri would conduct exams for me, the oral exam simulator sessions. And whenever I used to try to find the answer, I tried to cheat one day, I think. And she'd say no. I still miss those sessions. Thank you so much for being my teachers. And I think I'm the luckiest student ever to have 5 teachers teaching me all the time. And it was a
Mm.
luxury. I think um, I felt so pampered. Thank you so much. And I'm proud of myself because I'm interviewing my teacher today. Thank you so much
Yes.
for accepting our invitation and giving us some time for this professional talk. I don't even know how this talk went, but I'm so nervous to talk to my teacher. I hope all of you understand, whoever is watching this video understands. She is my teacher. Okay. Thank you so much. Lots of gratitude. Thank you. Thank you. Are you proud of me too?
Yes. Oh, absolutely. I just love what you're doing. And for all those interns, that is really wonderful. So, and I saw when I watched you how many logged on, and I just thought that is fabulous. If you saw the demand and the real need for that, then that is just brilliant, Harika.
Thank
So
you.
well done. I am really proud of you and where you're working, and the fact that you've had regional Australia as well as now metropolitan Australian experience, like to be
Yes.
able to draw and grow on both of those experiences is really amazing. And that's what you want to show and tell it everyone, yeah, share all that experience, which is really great. So well done.
Thank you so much. And I must say, regional Australia is like a home. There's so much love around and support around. And
Yes,
I
the
think it has
community.
been 4 years since I, really saw Sherri, but she still remembers me. That means so much to me. That means a lot to me. Thank you so much. Thank you so much.
Yes, and I think that's probably a big message out of today, Harika, is don't be afraid to step out of the city. You will find it really fulfilling.
Sure.
Yeah, I agree.
Yeah. The
Mm.
rural Australia is the best place to work, I would say. And that is where they need you the most. I mean, like pharmacists are
Yes.
required there. And if you were if pharmacist is able to move there and serve the community, they would have a lot of love for you and they support you. And yeah, it's a best place to work, I would say.
And do your homework. Find out, ask around who is good to work for or what pharmacies are in that community. And yeah, it's important because it's your job. You're going to be there every day. And yeah, it's for your happiness. It's really important.
Thank you so much. Thank you so much once again. Thank you.
Thank you. Thank you.
Thank you.
Pleasure.
See you soon.
Pleasure. See you soon.
Bye.
And good luck to all the listeners as well.
Thank you. Thank
Thanks
you
for
so
having
much.
me.
Thank you so
Okay.
much.
Bye.